Before we begin today's video, let's practice a bit of mindfulness. Firstly, look at the screen, then slowly close your eyes. And as you do, just leave your mind blank. Then, take in a deep breath through the nose slowly, then out through the mouth. One more time, in through the nose and out through the mouth. And one last one. Now slowly open your eyes and let's begin today's video. In today's video, we're going to be talking about the human's lungs anatomy, its common illnesses, as well as its rare illnesses. I am going to explain every part of the human lung listed on screen right now. Thyroid cartilage. Thyroid cartilage is the tough, flexible tissue that forms the front part of the larynx, the voice box. It supports and protects the vocal cords and helps create the sound of a person's voice. The cricoid cartilage. The cricoid cartilage serves to maintain airway patency, forms part of the larynx, and provides an attachment point for key muscles, ligaments, and cartilage, which function in the opening and closing of the vocal cords for sound production. The trachea. The trachea originates at the inferior edge of the larynx. It connects to the left and main stem bronchus. The primary function of the trachea is to allow passage of inspired and expired air into and out of the lung. The trachea is a midline structure and lies just anterior the esophagus. The right upper lobe. The right upper lobe of the lung is one of the three lobes that make up the right lung. The lung tissue of this lobe is responsible for most of the gas exchange in the right lung during calm, shallow breathing. The right middle lobe. The right middle lobe of the lung is located between the right upper and lower lobes. Situated laterally in the chest, its function is to facilitate gas exchange by providing a surface area for oxygen to enter the blood and carbon dioxide to be expelled. The right lower lobe. The right lower lobe of the lung is located at the bottom of the right lung, occupying the posterior and inferior portions of the chest cavity. Its primary function is to facilitate gas exchange, particularly in the lower parts of the lung, where blood flow is more abundant, aiding in efficient oxygen uptake and carbon dioxide removal. The left upper lobe. The left upper lobe of the lung is located at the top of the left lung, extended towards the front and back of the chest, and its function is to facilitate gas exchange, particularly in the upper part of the lung. The left lower lobe. The left lower lobe is situated at the bottom of the left lung, occupying the lower and back portions of the chest cavity, and its function is to efficiently exchange gases in the more gravity-dependent areas where blood flow is greater. The right primary bronchus. The right primary bronchus is located just below the trachea, branching off towards the right lung at a steeper angle than the left bronchus. Its function is to conduct air into the right lung, where it further divides into smaller bronchi to distribute air to the three lobes of the right lung. The right lobe and left lobe of the lung. Each lung has their very own lobe. The one on the right lung is called the right lobe, and the one on the left lung is called the left lobe. The left primary bronchus. The left primary bronchus is located below the trachea and directs air into the left lung, where it branches into the left upper lobe bronchus and lower lobe bronchus. The left upper lobe bronchus. The left upper lobe bronchus supplies air to the upper lobe, facilitating gas exchange in the upper part of the lung, while the lower lobe bronchus directs air to the lower lobe for efficient gas exchange in the lower regions. The cardiac notch. The cardiac notch is a concave indentation located on the medial surface of the left lung, adjacent to the heart. Its function is to accommodate the heart's position within the chest, allowing space for the heart while still enabling the left lung to expand during breathing. In this chapter, we're going to be talking about common lung illnesses. Asthma. Asthma is a chronic condition characterized by inflammation and narrowing of the airways, leading to difficulty breathing. Chronic obstructive pulmonary disease, or COPD for short. COPD is a group of lung diseases including emphysema and chronic bronchitis that cause airflow blockage and breathing problems. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs, which may fill with fluid or pus. Tuberculosis, or TB for short. TB is a bacterial infection caused by Mycobacterium tuberculosis, primarily affecting the lungs, but can spread to other organs. Lung cancer. Lung cancer is the uncontrolled growth of abnormal cells in the lungs, which can form tumors and interfere with normal lung function. Pulmonary fibrosis. Pulmonary fibrosis is a condition where the lung tissue becomes damaged and scarred, leading to stiffened lungs and difficulty breathing. Bronchitis. Bronchitis is an inflammation of the bronchial tubes, which carry air to and from the lungs. Interstitial lung disease. Interstitial lung disease, or ILD for short, is a group of disorders that cause scarring of lung tissue, leading to stiffness and difficulty in breathing. In this chapter, we are going to be talking about rare lung illnesses. Pulmonary alveolar proteinosis, or PAP for short. PAP is a condition where a protein-rich material builds up in the alveoli, air sacs of the lungs, impairing gas exchange. Symptoms include shortness of breath, cough, and fatigue. Lymphangioliomyomatosis. That's a mouthful. But to make it easier for you guys can just say LAM, L-A-M, and that summarizes the name. That's an abbreviation of the name. So let's get into the definition. LAM is a rare lung disease that primarily affects women of childbearing age. It involves the abnormal growth of smooth muscle cells, especially in the lungs, leading to lung damage, cyst formation, and reduced lung function. Idiopathic pulmonary fibrosis, or IPF for short. IPF is characterized by the progressive scarring of lung tissue, leading to a decline in lung function over time. The cause is unknown, and symptoms include shortness of breath, a dry cough, and fatigue. Pulmonary hypertension, or PH for short. PH is a condition where the blood pressure in the arteries of the lungs is abnormally high, causing strain on the heart. It can result in symptoms such as shortness of breath, chest pain, and dizziness. Bronchiolitis obliterans, or BO for short. Also known as popcorn lung. BO is a rare, irreversible obstructive lung disease where the bronchioles, small airways in the lungs, become inflamed and scarred. This condition is often associated with exposure to certain chemicals or respiratory infections. Eosinophilic pneumonia. Eosinophilic pneumonia is a condition that involves the accumulation of eosinophils, a type of white blood cell in the lungs, leading to inflammation. It can be either acute or chronic, and symptoms include cough, fever, and difficulty breathing. Pulmonary Langerhans cell histiocytosis, or PLCH for short. Again, a mouthful, but it's an abbreviation. PLCH is a rare interstitial lung disease where Langerhans cells, a type of white blood cell, build up in the lungs, leading to cysts and nodules. It is often associated with smoking. Goodpasture syndrome. Goodpasture syndrome is an autoimmune disorder where the immune system mistakenly attacks the lungs and kidneys, causing bleeding in the lungs and kidney failure. It can present with coughing up blood and shortness of breath. We have now reached the end of today's video. With that, I would like to congratulate you if you made it this far. And if even though you skipped, my advice for you is to go back and watch the video, because you probably learn a lot about the lung if you watch this video. And if you didn't skip and watched all this video, I hope you learned a lot about the lungs, and I hope it's helpful to you later on in life, and even right now in life. Thank you for watching, and before I go, please like and subscribe and share to your friends and families to put this video more out there so everybody can learn about the different parts of the body I talk about in almost every one of my videos. And again, before I ponder off and just keep on yapping, have a good day.